Hello, this question is for Dr. Acton. This is Ori Givens from Spectrum News 1. We've been getting a lot of feedback from pharmacists about various issues, whether it's PPE or distancing in grocery stores. We have one big concern that they're seeing a lot of prescriptions for a drug called hydroxychloroquine, which I guess the president also tweeted about today. Can you just talk to the policy around that drug, and should we be seeing all these prescriptions at this time?
You know, as Dr. Fauci said, you know, this is an experimental, compassionate use of this drug because, of course, in the timeframes we're seeing, you know, no one's able to do those trials yet. There were some thoughts of its use in China and elsewhere, I believe France. But it's important to know that this drug is very, very vital to people with rheumatologic diseases. There are other uses of this anti-malarial drug, and we can't have a rush on this drug in asymptomatic people. This is a drug you take when the governor does so much work in Haiti. When we went there on a trip, this is what you take as prophylaxis for malaria. You know, there's a limited supply of it. And similarly, again, we're talking, this is a social contract, folks. We've got to work together. I've worked specifically, my team has reached out to the pharmacy board. We've got to limit the prescription to 14 days if we are going to use it in these compassionate use circumstances so that people don't just stockpile it and try to sell it or misuse it, because there are patients who have autoimmune diseases and arthritic diseases. The rheumatologists are really speaking up right now. I think this would be a great thing at the federal level as well to take a look at, because we want to be flexible here as we try everything we can. And again, everyone's trying everything they can, but we also have to think about, you know, those other complications as you're mentioning. Thank you.
Thank you.